Hi, it's Bill, the knee pain guru. Welcome to Monday, January 20th, 2020, Martin Luther King Jr. Day. Today we're going to talk about gaining range of motion after knee replacement surgery. We're going to get into that in just a moment. We're going to do a short presentation in just a moment. If you have questions, you're dealing with issues after a knee replacement, pain, range of motion, scar tissue, whatever that is, please put your comments, questions in the live chat over on the side, and we'll address those after the presentation. And if you're watching the replay, your comments, your questions, I take that in and I use those for future videos. We do these about twice a week. So give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications. And share this video with your friends. There's a lot of people limping around with knee replacements that need to hear this information. So now we're going to get into the topic of today, which is gaining range of motion after knee replacement surgery. It's a tricky proposition because the doctors are touting this as being the solution to what you were dealing with before. Consequently, I get lots of people who are reaching out to me who have already had a knee replacement surgery, and they're less than pleased with how everything turned out. And one of the issues that they're running into is gaining range of motion. They have a limited range of motion. So I went on the internet to figure out, well, the range of motion with a replaced knee is different than the range of motion in a normal knee. Normal knee meaning a knee that hasn't had a knee replacement. And they're on the University of Connecticut website, the UConn website, there was a kinesiology link there that I will put in the notes below. And they were saying what is considered full range of motion in the knee after a total knee replacement is straight. So that would be 0 degrees, and anywhere's between 90, bending your knee 90 degrees, and a little bit more, 120. So generally what happens is clients come reaching out to me, or people who have had knee replacements reach out to me, and they're stuck anywhere's in here, which means going up and down stairs is extremely difficult. They have to go up and down sideways. Getting in and out of a chair is very difficult. Getting in and out of a car is very difficult. And they're generally going, by what the doctors are saying, is they have a window from when the knee replacement was done. Then they go into physical therapy. And in that window of time, they need to get the full range of motion back so their knee is functioning properly. And most of the time, the doctors are pointing towards scar tissue. Well, that's the reason. Your body is building scar tissue, and that's what's stopping the range of motion in the knee. So that's why you're only getting to 85 degrees or 80 degrees or whatever it is. You can't get to the full 90 degrees or a little bit more after that. And at this point, they're going to physical therapy, which is forcing the joint. They're strengthening the muscles in the legs and forcing the joint into that range of motion, hopefully getting it into the range of motion. And if they do not achieve that level of range of motion in that window that the doctor is setting, then what the doctors are pointing towards is manipulation under anesthesia, which is putting the patient unconscious and then forcing the joint to the full range of motion, which is the 90 to 120 degrees. And when the person wakes up, they're going to hope that that's going to stick, that breaking down the scar tissue is the reason that's why the joint isn't getting the full range of motion. Let's see, have notes here. I want to make sure I cover everything. So that is generally the medical model in terms of the conventional medical model in terms of gaining the range of motion in the knee. So what do? If you're not getting range of motion in the knee, you can't handle the pain anymore. And now the doctors are proposing manipulation under anesthesia or continued physical therapy that's painful. What's important to understand is one of the factors that goes into the range of motion in the knee, or any joint for that matter, is the function the nervous system plays in that whole equation. Well, the nervous system is our brain, our spinal cord, all the nerves that go out to every part of our skin. Our fingertips, our toes, goes through the hips, into the knees, and all of that. And what happens is when the body has been through trauma, which anybody who has had a knee replacement surgery, that in and of itself is a trauma, let alone the years that they probably went through pain to the point of having the trauma of the knee replacement surgery. So they've had the trauma for years of the knee being in pain, probably an injury before that, then years, sometimes decades of pain, and now you have the bones in your leg sawed off and replaced with plastic and metal. Well, what happens to any living organism when they're put through trauma after trauma after trauma after trauma? The body tenses up to protect itself. You can feel this. You can't really put a finger on it, but you could feel it. You get a sense of it in your knee, in your leg, in your hips, in your lower back, in your body. The body is tensing up to protect itself because it doesn't want to feel the pain. Normal, natural response. That's how we function as humans. So going the conventional medical model route, which is pushing through the pain, strengthening the legs, we're going to render you unconscious again, and then force the joint into a range of motion that it doesn't want to go in, further trauma to the system. And it is kind of the definition of insanity. You're doing the same things over and over, expecting a different result. The body has had enough trauma. The knee has had enough trauma. The leg has had enough trauma. And now we need to look and understand what's going on in the body from a higher perspective. Like Einstein said, we can't solve a problem on the level that the problem was created. So we have this problem in your knee caused on a physical level. We have to come at it from a neurological level in order to begin to change the neurological signaling that's going on in the knee by creating comfort. And when we create comfort, the neurology begins to shift and change. It relaxes. There's more space created. It gets the pressure off of the nerves in the knee that are being squeezed, causing the pain, stopping or limiting the range of motion. So there's three places that we need to look at in order to gain the range of motion in the knee. There's three places in the body we need to look at, we need to address. Most people say the knee. And yes, absolutely. We need to address what's going on in the knee, create comfort there, address what level of scar tissue we're able to access in and around the knee to increase the range of motion in the knee. But it's important to understand that the body just isn't the knee. The body's an interconnected series of pulleys and levers, meaning when you walk, when you bend your knee, your foot, your shin, your calf, your quad, your hamstring, your hips, and your lower back all play a role in that. All play a crucial role in the ability of the knee to bend. And if we're only looking at the knee, we're leaving so much on the table. It's like tunnel vision. We got to get the range of motion in the knee. We have to acknowledge the fact that the hips and the lower back play a huge role in the range of motion of what's going on in the knee. So if we're just creating comfort in the knee and we're not creating comfort in the hips and the lower back at the same time, we may get a little increase of motion in the knee, but the hips and the lower back are still locked up. They're still tensing up to protect the knee. Think about it. Even if you're sitting there watching this video, you can feel the tension as you're sitting there in your hip with the same knee that you had the surgery in. Okay, I'm going to pause here for just a moment. We have a few people watching. If you have questions, please ask those, comments, remarks, whatever you're dealing with. Does this sound familiar? Am I spot on? I mean, I'm sure I'm pretty close, if not right there, because I've worked with thousands of clients over the past 11, going on 12 years of doing this online. So it's pretty spot on in terms of what's happening if you've been post-knee replacement. I've had a few clients who've recently begun working with my group coaching program called Knee Club, and we're specifically addressing the scar tissue buildup. And they recognize this is not a quick fix, that when you've had that level of trauma in the knee, in the body, the level of surgery that they've had, the pain that they were in for a long period of time, the injury they had before they got into pain, and it's going to take some work of changing the neurological signaling. And most of the time, it's not just the neurological signaling, it's the patterns, the belief systems that are in the brain that are playing a huge role in what goes on in the knee. So, is that making sense? Is it not making sense? Sound good? So by creating comfort in the knee, we switch neurological states, which allows the body to relax and let go of the tension. And essentially that trauma begins to move out of the system, out of the neurology. You feel more relaxed, you feel more comfortable. And not only do you feel more relaxed and comfortable, but you also begin gaining the tools and the skills on how to get your knee out of pain, how to get it to relax day in and day out, over and over and over again. And it opens up a new realm of possibility for what's going on in your knee. Now, a lot of people are like, at this point, like, what do I do now, Bill? Okay, there's 3 different things you can do at this point. One is if you're seeing this video for the first time, because people come straight off of YouTube and are introduced to my work, head over to my website, thekneepainguru.com, and get on my newsletter list, where I'll send you out emails on just shifting the mindset, because this is definitely a mindset shift from what you've been exposed to this point. So that's if you're hearing this information for the first time. If you're on my newsletter list and you haven't got involved in one of my programs, then you've received notification of this in an email, and right below that there is a link for getting more support, and that will take you to a products page where I have 3 different products that you could begin working with to start getting some results of what's going on in your situation with your knee replacement. And then if you're already working with one of those programs, you would also be receiving this. And you're getting stuck, because I have programs where you can work on your own or you can work with me. And if you're working on your own and you get stuck, you hit a plateau, you're like, well, I got results for a little bit period of time, but then I didn't know what happened. You need more support. This is a very different approach by looking at it through the neurology, the signals that your body is giving out constantly. Signals of tension or relaxation or movement or pain or stiffness or tightness or whatever that experience is for you. That is like the dashboard on your car giving you signals as to, well, do I need to go get the oil changed, or do I need to get the engine checked out, or there's something going on with the heater. It all depends on what the signal is. And that's where in my different programs we interpret those signals and then give you actionable steps that you could begin working with until the next call, until the next time we touch base. And then you give that feedback. And it shifts, working with me, shifts that mentality from thinking pain is bad to now pain is information. Pain is something that I could use to know what my body needs to get it to feel better. It takes you out of the victim mode. There's nothing I can do, and I've tried everything, and there's woe is me, and I'm stuck, I'm frustrated, whatever it is. I get that. However, that's not what this is. This is about taking that stuck place and empowering you with the knowledge and understanding of what's going on with your body, so you have action steps to move you forward from that place, get you unstuck, and then developing the habits in your life that will continue moving you and your knee to a place of having more flexibility and mobility and strength and feeling young. Okay. Any questions? No questions? Sound good? Okay. Give the video a thumbs up, like and subscribe to my channel, turn on notifications for future videos. I do these on Mondays and Thursdays. You can forward this email to people that you know with knee pain, especially those who are struggling with range of motion, who have had a knee replacement surgery. So no questions. Okay, great. This is Bill Paravano, the knee pain guru, going to sign off for today. Have a wonderful day, and I will see you on the next video.